Dr. Larry Lika. I'm an orthopedic surgeon at Southwest General. I specialize in doing anterior approach total hip replacement arthroplasties. 20 years ago, I was one of the first surgeons to bring this approach to Cleveland, and is doing hip replacements from the front and not from the back. And it's a minimally invasive, we're not muscle-sparing procedure, that we're not taking down any muscle. So therefore, the patients are able to be fully ambulatory immediately, no crutches, no cane, no walker, with no limitations. I went to undergraduate school at Mount Union College, and then Ohio University Medical School, and I did my residency training in Canton, Ohio. Well, I always liked the sciences. I always liked building things, and orthopedics is building things, is reconstructing joints and building things. I think patients need to have a lot of time spent with them. They need to understand the treatment, they need to understand the operation and what to expect afterwards. So I think spending a lot of time with patients to make sure that we answer all their questions is important. Well, I've been married for 28 years. I have 4 children, a 21-year-old and 20-year-old triplets. So they've kept me very busy. The Southwest General is a wonderful hospital. The operating staff is phenomenal, the nursing staff, the physical therapy, all trying to get patients back to their quality of life and normal activity level. I think it's a wonderful hospital to practice at. I do have a patient who was 90 years old, who was an avid golfer. His life was golfing. And he came to my office in a wheelchair, and he said, I want my knee replaced. I don't care how old I am, I want to be able to golf again. And after his knee replacement, he was able to golf for another 5 years and have a fulfilling life. Well, I think AI is going to revolutionize everything, not only in medicine, but in everything. And I think we have to stay on top to see how can we get AI to improve patient care. Orthopedics, we're making people better. We're trying to get them back to their previous level of activity. Patients present to the office with the crutches, on a walker, or in a wheelchair. And by doing surgery, hip replacements, and knee replacements, we're able to return them back to the quality of life that they used to have.